If you have diabetes or prediabetes and you're experiencing erectile dysfunction, this isn't a coincidence. It's a direct result of what high blood sugar is doing to your body. 75% of men with diabetes develop erectile dysfunction, yet most doctors never explain this connection or how to prevent it. Today, I'm revealing the hidden mechanisms by which diabetes destroys sexual function and, more importantly, the proven strategies to restore erectile function even if you've had diabetes for years. The pharmaceutical industry wants you to believe that diabetic erectile dysfunction requires expensive medications for life, but research shows natural approaches can be remarkably effective. The connection between diabetes and erectile dysfunction goes far beyond what most people understand. It's not just about blood flow. Diabetes attacks your sexual health through multiple pathways, including nerve damage, blood vessel destruction, hormone disruption, and psychological factors that create a perfect storm for sexual dysfunction. Understanding these mechanisms is crucial because once you know how diabetes is damaging your sexual health, you can take specific actions to interrupt these processes and restore function naturally. Many men with diabetes have completely reversed their erectile dysfunction using the methods I'm about to share. Dear Spam, how diabetes destroys sexual function. High blood sugar acts like glass shards flowing through your bloodstream, systematically damaging every tissue it contacts. Your penis contains some of the most delicate blood vessels and nerves in your body, making it particularly vulnerable to diabetic damage. When blood glucose levels remain elevated, sugar molecules bind to proteins in your blood vessels through a process called glycation. These advanced glycation end products damage the endothelium, the inner lining of your blood vessels that produces nitric oxide essential for erections. Damaged endothelium can't produce adequate nitric oxide, the molecule that signals blood vessels to relax and allow blood flow to your penis. Without sufficient nitric oxide, achieving and maintaining erections becomes increasingly difficult, regardless of sexual desire or stimulation. Chronic high blood sugar also promotes inflammation throughout your cardiovascular system. This inflammation further damages blood vessels, reduces their flexibility, and impairs the rapid blood flow changes necessary for healthy erections. Over time, diabetes causes atherosclerosis, hardening and narrowing of arteries throughout your body. The small arteries supplying your penis are among the first affected because they're much smaller than coronary arteries feeding your heart. This explains why erectile dysfunction often appears years before heart disease symptoms in diabetic men. Your penis serves as an early warning system, alerting you to cardiovascular damage that could later cause heart attacks or strokes. Tawam, diabetic neuropathy and sexual function. Diabetic neuropathy, nerve damage from high blood sugar, represents another major pathway by which diabetes causes erectile dysfunction. The nerves controlling sexual response are particularly susceptible to glucose damage. Your autonomic nervous system controls the involuntary processes necessary for erections, including blood vessel dilation, smooth muscle relaxation, and nerve signal transmission. High blood sugar systematically damages these nerve pathways. Peripheral neuropathy typically appears first in hands and feet as numbness, tingling, or burning sensations. However, the same nerve damage simultaneously affects the nerves controlling sexual function, often without obvious symptoms until erectile problems develop. The pudendal nerve, which provides sensation to your penis and controls ejaculatory function, becomes damaged by chronic high blood sugar. This results not only in erectile dysfunction, but also reduced sensation during sexual activity. Damage to the cavernous nerves that control blood flow into penile erectile chambers is particularly devastating for sexual function. Once these nerves are significantly damaged, Even perfect blood sugar control may not fully restore erectile function. The encouraging news is that nerve tissue can regenerate when blood sugar is properly controlled, and specific nutrients support nerve healing. Many men with diabetic neuropathy have experienced significant improvements in sexual function through comprehensive diabetes management. Hormonal disruption from diabetes. Diabetes doesn't just affect blood vessels and nerves. It also disrupts the complex hormonal systems that support healthy sexual function. Men with diabetes typically have lower testosterone levels compared to non-diabetic men of the same age. High insulin levels, common in type 2 diabetes, interfere with testosterone production in your testicles. Insulin resistance forces your pancreas to produce excessive insulin, creating hormonal environment that suppresses masculine hormone production. Chronic inflammation from diabetes elevates cytokines that interfere with the hypothalamic pituitary testicular axis, the complex system that regulates testosterone production. This results in both reduced testosterone synthesis and increased testosterone conversion to estrogen. Obesity, which commonly accompanies type 2 diabetes, further compounds hormonal problems. Fat tissue contains aromatase enzyme that converts testosterone to estrogen, creating feminizing hormonal environment that suppresses sexual function. The combination of reduced testosterone production and increased conversion to estrogen creates double impact on sexual health. Low testosterone reduces sexual desire and erectile function, while elevated estrogen further suppresses masculine sexual characteristics. Pokračuje. Psychological factors in diabetic erectile dysfunction. Living with diabetes creates psychological stress that independently contributes to erectile dysfunction. The constant worry about blood sugar levels, dietary restrictions, and potential complications elevates cortisol levels that suppress sexual function. Performance anxiety becomes particularly problematic for diabetic men who experience initial erectile difficulties. Worrying about sexual performance increases stress hormones that make erections even more difficult, creating vicious psychological cycle. Depression affects up to 25% of men with diabetes, twice the rate of non-diabetic men. Depression directly impacts sexual desire and function through neurotransmitter changes and medication side effects that compound physical causes of erectile dysfunction. Relationship strain from managing chronic disease can affect intimacy and sexual satisfaction. Partners may worry about the diabetic partner's health during physical activity, creating additional psychological barriers to healthy sexual function. Body image concerns from diabetes-related weight gain, insulin injection sites, or other physical changes can reduce sexual confidence and contribute to performance anxiety. Workup. Prediabetes and early sexual dysfunction. You don't need full diabetes diagnosis to experience diabetes-related erectile dysfunction. Prediabetes, blood sugar levels higher than normal but not yet diabetic, can cause significant sexual problems. Prediabetes affects approximately 96 million American adults, with most unaware of their condition. Erectile dysfunction may be the first symptom that alerts men to blood sugar problems, providing opportunity for early intervention. Even mild blood sugar elevations begin damaging blood vessels and nerves essential for sexual function. The good news is that prediabetes damage is often completely reversible with proper lifestyle interventions. Men with prediabetes who implement comprehensive lifestyle changes often experience dramatic improvements in sexual function as blood sugar normalizes. This provides powerful motivation for diabetes prevention efforts. Hemoglobin A, 1C levels between 5.7 to 6.4% indicate prediabetes and warrant aggressive lifestyle interventions to prevent progression to full diabetes and preserve sexual health. Medication-related sexual problems. Many medications used to treat diabetes and its complications contribute to erectile dysfunction through various mechanisms. Understanding these effects allows for better medication choices that preserve sexual health. Some blood pressure medications commonly prescribed to diabetic men significantly worsen erectile dysfunction. Diuretics and beta blockers are particularly problematic for sexual function and should be avoided when possible. Antidepressants prescribed for diabetes-related depression often cause severe sexual side effects that compound physical causes of erectile dysfunction. SSRIs are notorious for eliminating sexual desire and making orgasm difficult or impossible. Insulin therapy, while life-saving, can contribute to weight gain and fluid retention that negatively impact sexual function and body image. Proper insulin management minimizes these effects while maintaining blood sugar control. Statin medications used to treat diabetic dyslipidemia may contribute to erectile dysfunction in some men by reducing testosterone production. However, the cardiovascular benefits usually outweigh sexual side effects. Working with healthcare providers to choose diabetes medications with minimal sexual side effects is crucial for maintaining quality of life while managing blood sugar effectively. Welcome to Senior Health Tips. If you're discovering how diabetes is secretly destroying your sexual health, please subscribe and hit the bell icon for more men's health content designed for men over 50 with chronic conditions. I want to ask you, did you know about the connection between blood sugar and erectile function? Have you experienced sexual changes since developing diabetes or pre-diabetes? Leave a comment below about your experience with diabetes and sexual health. Your story might help other men facing similar challenges. Kjærkbamers. Natural methods to reverse diabetic erectile dysfunction. The most powerful intervention for diabetic erectile dysfunction is achieving excellent blood sugar control through diet, exercise, and lifestyle modifications. Many men experience dramatic improvements in sexual function when A1C levels drop below 7%. Low-carbohydrate diets are particularly effective for reversing both diabetes and erectile dysfunction. Reducing carbohydrate intake lowers blood sugar, reduces insulin requirements, decreases inflammation, and often leads to significant weight loss. Studies show men following ketogenic diets, very low carbohydrate, moderate protein, high healthy fat, experience improvements in erectile function, testosterone levels, and overall sexual satisfaction. Intermittent fasting helps improve insulin sensitivity, promotes weight loss, and may boost testosterone production. Time-restricted eating patterns allow your body to recover from constant insulin stimulation. Regular exercise is crucial for diabetic men with erectile dysfunction. Physical activity improves insulin sensitivity, enhances blood flow, reduces inflammation, and naturally boosts testosterone production. Both cardiovascular exercise and resistance training provide benefits for sexual health. Aim for at least 150 minutes of moderate exercise weekly, including 2 to 3 strength training sessions. High-intensity interval training may be particularly beneficial because it improves glucose metabolism while naturally boosting growth hormone and testosterone production. Bien. Specific foods for diabetic sexual health. Certain foods provide targeted benefits for men with diabetes and erectile dysfunction by improving blood sugar control, reducing inflammation, and supporting sexual function. Leafy green vegetables like spinach and kale are loaded with nitrates that convert to nitric oxide, improving blood flow despite diabetic blood vessel damage. These vegetables also provide nutrients that support nerve health. Berries contain powerful antioxidants that protect blood vessels from diabetic damage while providing minimal impact on blood sugar. Blueberries, strawberries, and blackberries all support vascular health. Fatty fish like salmon and mackerel provide omega-3 fatty acids that reduce inflammation, support nerve health, and may improve insulin sensitivity. Aim for 2 to 3 servings of fatty fish weekly. Nuts and seeds provide healthy fats, protein, and nutrients that support sexual health without spiking blood sugar. Almonds, walnuts, and pumpkin seeds are particularly beneficial. Dark chocolate with 85% or higher cacao content provides flavonoids that improve blood flow and may enhance insulin sensitivity. Limit portions to 1 to 2 squares to avoid blood sugar spikes. Avocados provide healthy monounsaturated fats that support hormone production while having minimal impact on blood sugar. They also contain nutrients that support nerve health. Garlic has been shown to improve both blood sugar control and erectile function through its effects on nitric oxide production and blood vessel health. Foods that worsen diabetic erectile dysfunction. Refined carbohydrates and sugars cause rapid blood sugar spikes that accelerate diabetic complications, including sexual dysfunction. Eliminate white bread, pasta, rice, and sugary foods completely. Processed foods contain inflammatory ingredients, hidden sugars, and harmful additives that worsen both diabetes and erectile dysfunction. Focus on whole, unprocessed foods whenever possible. Trans fats found in margarine, commercial baked goods, and fried foods are particularly damaging to diabetic men because they increase inflammation and worsen insulin resistance. Excessive alcohol consumption worsens blood sugar control and can cause peripheral neuropathy that compounds diabetic nerve damage affecting sexual function. High-sodium processed foods contribute to high blood pressure, which commonly accompanies diabetes and independently causes erectile dysfunction. De Crau. Supplements for diabetic erectile dysfunction. Alpha-lipoic acid is a powerful antioxidant that can help reverse diabetic neuropathy and improve sexual function. Studies show 300 to 600 milligrams daily can significantly improve nerve function in diabetic men. L-arginine provides the raw material for nitric oxide production, potentially overcoming some of the endothelial dysfunction caused by diabetes. Typical doses range 3 to 5 grams daily. Chromium picolinate may improve insulin sensitivity and blood sugar control, indirectly supporting sexual health. Doses of 200 to 400 micrograms daily have shown benefits in diabetic men. Coenzyme Q10 supports cellular energy production and may help protect against diabetic complications, including sexual dysfunction. Doses of 100 to 300 milligrams daily are commonly used. Vitamin D deficiency is common in diabetic men and is associated with both poor blood sugar control and erectile dysfunction. Most men benefit from 2,000 to 4,000 IU daily. B-complex vitamins, particularly B1, B6, and B12, are essential for nerve health and may help prevent or reverse diabetic neuropathy affecting sexual function. Number, medical interventions. When natural methods aren't enough. While natural approaches should be the foundation of treatment, some diabetic men may benefit from medical interventions when lifestyle changes alone are insufficient. Phosphodiesterase 5 inhibitors like sildenafil may be more effective in diabetic men when combined with excellent blood sugar control and lifestyle modifications. Testosterone replacement therapy may be appropriate for diabetic men with documented low testosterone levels, but requires careful monitoring due to potential cardiovascular risks. Vacuum erection devices provide mechanical solution that bypasses some of the vascular and neurological damage from diabetes, while natural healing processes occur. Penile injections may be necessary for men with severe diabetic complications, but should be considered only after comprehensive lifestyle interventions have been attempted. Monitoring progress and expectations. Track both blood sugar control and sexual function improvements using objective measures. Monitor A1C levels, fasting glucose, and sexual health questionnaires to assess progress. Improvements in erectile function often lag behind blood sugar improvements by several months, as damaged tissues heal and regenerate. Be patient and consistent with lifestyle interventions. Some diabetic men experience rapid improvements in sexual function with lifestyle changes, while others require 6 to 12 months to see significant changes. Individual responses vary based on duration and severity of diabetes. The combination of excellent blood sugar control, regular exercise, proper nutrition, stress management, and appropriate supplementation provides the best chance for restoring sexual function in diabetic men. Remember that diabetes doesn't have to mean the end of your sex life. With proper management and natural interventions, many men with diabetes enjoy healthy, satisfying sexual relationships throughout their lives. Early intervention is crucial. The sooner you address both diabetes and sexual dysfunction, the better your chances of complete recovery and prevention of further complications. Your sexual health is an important indicator of your overall diabetes management and quality of life. Don't accept erectile dysfunction as an inevitable consequence of diabetes. Take action to restore both your metabolic and sexual health naturally.